Hi, this is Dr. Mercado here, Orange States Dental, your local dentist here in Downey. Get a lot of questions about root canals, what they are, how we do them, and whatnot. So I want to spend a few minutes answering some questions about root canals so you get a better understanding about the topic. So root canal treatment is pretty much the fancy words that we use to actually get rid of a nerve of a tooth. We don't take tooth out, but pretty much a root canal is a process where the nerve of the tooth is taken out. So there's a couple of things that happen or you might feel when you have or you need a root canal. For the most part, it's pain. Some sensitivity to hot and cold, especially hot. If you have some pain to hot, you pretty much for sure need a root canal. In terms of pain, that's sort of one symptom, but a lot of times there's no pain. A lot of times you have zero pain, and there's other symptoms that can only be diagnosed at a dentist with an x-ray, with some touching and feeling around the tooth is how you can diagnose. But usually pain to hot and cold, and every once in a while, very little pain. So as far as cracked teeth, root canals can actually be used to save cracked teeth. Now, if your tooth's cracked, there's a difference here. So if the crack is pretty small, it's definitely possible for a root canal to be used and done to save the tooth. Now, if it's a bigger crack in terms of something down to the root, to the nerve, for example, that's kind of touch and go. We take an x-ray and look to see if actually the tooth can be saved with a root canal. So root canals are real good when they're useful, and when they're useful is because it's time or there's still hope for the tooth. So if you come in to the dentist and you have quite a beat up tooth and it's broken down, it's been hurting a long time, you might not need a root canal anymore. You might actually lose a tooth. But for the most part, it's too late to use a root canal, do a root canal when the tooth isn't restorable in the sense that it can be built back up. So you have so little tooth left over that even with the root canal, we can't really put anything back on top of that tooth. So a root canal procedure is pretty simple. There's a couple steps. For the most part, we're just cleaning and washing out the inside of the tooth, right? We do that back and forth a few times until the tooth is fully cleaned out and pretty much ready to be filled up. And that's that second step. So that second step, we fill the tooth up. And the third step is actually covering the tooth back up. After the root canal is done, we want the tooth covered back up. So root canals procedures, they go a little while. It can be quick as 30 minutes. Sometimes they can go in an hour, hour and a half, maybe in 2 hours. It just sort of depends on the difficulty, how difficult that tooth is in terms of how bad the tooth is, and also how many roots. Teeth have different number of roots. So some of the teeth that have more roots take a little longer to get done during a root canal, and the ones that have maybe one or maybe two roots are a little faster. So one of the things I talk to patients a lot about is after a root canal, you do need a crown, a dental crown in this case, right? So the crown is something that goes over the tooth. It's kind of like, we'll call it a cap, but it's almost or a helmet. It goes over the tooth. It's very important after a root canal to get an actual crown. Very, very important to get a crown. What happens after a root canal, tooth is saved. You're out of pain, you feel better. But now what happens because the nerve's gone, the tooth becomes brittle over time, weeks, months, years, but the tooth becomes brittle. And if you're chewing with a root canal with no crown or no cap, what happens, the tooth breaks. And then that's kind of all she wrote there. The anesthesia we use for the root canals is the same for most other dental procedures, and that's local anesthetic. So you don't have to be put to sleep. There's none of that necessary for a root canal. So it's pretty much local anesthetic that we use for everyday dental work. So as far as root canals have been studies, we've been doing root canals for decades, almost a century, right? So we have a lot of information of how root canals work out, how safe they are. And for the most part, root canals are very safe. The positive, the pros for root canal is a pretty big list as far as saving the tooth, how it works, how it functions, how long it lasts. And the negative or the drawbacks or the dangers of a root canal is actually very minimal. Really, the biggest danger for root canals is that the infection comes back. So the reason for the root canal being done sort of pops back up. That's the biggest reason that you would call a root canal unsafe, but for the most part, root canals are very, very safe. So as far as for a root canal and getting ready for a root canal, coming to your dentist, for the most part, the root canal, you don't have to do much. You show up, hopefully you're rested, hopefully you're not too sleepy or tired, but for the most part, there's nothing you have to do specifically to prepare for a root canal. Now, every once in a while, I will say, every once in a while, we have a situation where you have an existing infection. What we do, we prescribe medication, an antibiotic before you actually get the root canal done, but that's pretty much not very common. For the most part, there's nothing to prepare for a root canal. So one common question I get is how do I feel after a root canal? Now, I always tell patients, for the most part, you should be pretty comfortable after a root canal. You should have the same pain. So for example, if you had pain before you had the root canal, that pain should be gone. And I tell patients just from the motion from me working on your mouth and on your tooth, there should be some soreness, right? But we prescribe medication for that. There's pain medication, there's antibiotics we prescribe to handle some of the discomforts after the root canal. But as far as the major discomforts, we don't really expect that or see that. So one common question is definitely, will my tooth be sensitive after a root canal? So it should not be sensitive after a root canal. I would say the word should be soreness. So after a root canal, if your tooth is sore a little bit, totally okay. Couple days, it's a little sore. You can still, function, go to work, eat, and whatnot. But as far as being sensitive, your tooth should not be sensitive after a root canal, specifically to cold and hot. That pain or that discomfort shouldn't exist because and the idea is that there's no nerve. So that's what we don't want pain or sensitivity after that. So the recovery time for a root canal is different for different people. And mostly it's not so much the person, it's how the tooth is. So you had a big infection, a small infection, no symptoms, will kind of make the recovery time longer or shorter. But for the most part, the recovery for a root canal is pretty short. It's a couple days. That's pretty much the time you take to quote unquote feel the worst. But usually with common medications that we give, that we prescribe, it makes the recovery pretty quick and pretty easy. So the best way to recover after a root canal is to eat well, take vitamins, and get plenty of rest. Those things are super huge. They're kind of discounted or not really taken seriously sometimes. But if you take care of your body, your root canal will heal that much faster. So one thing that kind of come up together are root canals and dental implants. They are different procedures. It's not the same thing. As a root canal is one thing and a dental implant is a different thing, right? But what happens with that, what I talked about, is because when a root canal isn't a thing that can be done, or say a root canal fails, or it's just not an option, the tooth's taken out and an implant is placed. Now, as far as implants are great. We do them here at the office all the time. But if we can save your natural tooth, it's always best to try to do the root canal and save your own tooth. That's always better, right? For the most part, the implants are also beautiful. They work well. They fit well. They function on your own teeth. But as far as the pros, it's always better to keep your own tooth. Implants are great replacement for your tooth, but it's always second best, right? So that's kind of the benefit. The good thing with as far as cons for root canal and implants, there's very little cons. For the most part, is when people talk about costs, that's cons sometimes, right? With either root canal or implant, but that's pretty much the minimum time. As far as the cons for implant or root canal, that's kind of the minimum there. There's definitely way more pros on root canals than crowns, but always the deciding factor should be, is my tooth savable and should I keep my tooth? And yes, the natural tooth is always still better than an implant. So one thing we do after a root canal is that we do a crown. So when we do a crown for a root canal, there's a couple of reasons, but the main reason is after a root canal, your tooth gets brittle, it dries up. It's almost like some people call it a dead tooth. But yeah, it's dead for the most part. It still works. You can still chew with it, but the tooth becomes very soft, very brittle. So if you go a while, months, especially even years after a root canal without a crown or the cap that goes over it, the tooth will break. Now, some patients go years and they're like, oh, it hasn't broken yet, but eventually it will break. So that's the reason why we do a cap. After the root canal gets done, maybe there's a week or so healing time after the root canal, but we want to get a crown on there pretty quick because we don't want you chewing and then breaking your tooth after the root canal. And there goes the tooth. So costs for root canals vary. It depends really on the area you're in, and also your own tooth situation. So do you have, a tooth that's pretty big with, 1, 2, 3, 4, 5 roots? That will cost more than a tooth that has, say, 1 root and it's something very simple, very accessible, very quick to do. As far as specific costs, it ranges. It's hard to tell. It could be from a few $100s to even a few $1,000s. But again, the price tends to be related to what's happening and what the tooth is presenting in front of us. So I hope I was able to answer some of the common questions that I get on root canals. If you have any questions or you need a root canal and you take some action, give us a call here at Orange Steaks Dental. It's 562-659-7246. We're here to help.